Okay. So I've just started recording now. So now I've got 5 letters which I found in there's like 4 groups on Telegram. So I've got about 5 letters from those different groups, and there's about 2 groups on Facebook as well. So it's a variety of sources. So I have about 5 letters to have a look at. Zoom on the free account is only 40 minutes. So I'll try and get them done. Now, before I get started, does anybody have any questions? Now, you can either type your question in the chat box, or you can raise your hand and I can turn your microphone on and you can ask your question directly. Anybody got any questions before we get started? I take it that's a no then. So, I'm sorry. As I said, I'm not my best today, but we'll try and do the best that we can. Okay. So I've got 5. This is Dr. Abdihal. I took this from one of the Telegram groups, so you can have a look at it later. I'm going to save the changes. Okay. Now, the first things first, you don't have to put a period, full stop, after Mr., Mrs., or Ms. Everybody will tell you that because it's not. You want to use it if it's an abbreviation like captain or admiral or superintendent, not Mr., Mrs., Ms., etc. I'm writing to refer Mr. Taylor. Okay, ongoing management and assessment. Okay. Mr. Taylor is married with 3 children. He's an active patient. Active patient. Active person. I don't know if he would be active as a patient. I mean, he can't be that active. According to what you say, he can barely walk. So he's not so active, is he, really? He's a smoker and drinker. Well, that's kind of a short, unconnected sentence, but okay. Mr. Taylor presented at my clinic. Turn your videos off. We don't really need those. Complaining of limping and a swelling, or is it and? Limping and swelling in the left knee, which prohibited him from working effectively to support his family. Okay. Well, we can see he's a landscaper, so that does kind of make sense, because if you had to put that there, that would have been kind of strange. Okay. Upon the physical examination, well, what other kind of examination were you planning on giving him? A mental examination? A grammatical examination? Upon examination was a medial aspect tender point. Okay. Why do we have? Right, we've got short sentence, short sentence, short sentence, short sentence. His, he. Why don't you make some complex ones by joining these up? His range of movements were okay. Okay, that seems a bit informal to me. His range of movements were sufficient or adequate. Join that onto that. However, his power range was restricted. He was prescribed. Who prescribed this? Did you do it? If so, why did you write it as passive? I prescribed him 50 milligrams to relieve the pain. As a result, the pain relieved. What the pain was relieved, but the swelling did not improve. Okay. On today's review, he's very well understood that his condition. MRI. Can you count MRIs? Yes, you can. An MRI was ordered, which showed a damaged medial cartilage. In view of the above, I would greatly appreciate your expert care. You don't have to. You don't have to use it. I would greatly appreciate your expert care. It's, you know, for one healthcare professional to another. You don't really have to. I don't want to be crude, but you don't have to be an arse kisser. Your expert care. So for your care and assessment, obviously, it's implicit that it would be expert. I would hope so. I believe that Mr. Taylor may benefit from the removal of his damaged cartilage to prevent the possibility damaged cartilage, prevent the possibility of osteoporosis. I would put this for any queries and information. Feel free to contact me. I would put that as a separate sentence. Okay. So yeah, not too bad. Just watch the use of passive there. Okay, Dr. Not too bad. Ahmed, let's have a look. What do we have here? Miss Marjorie Jackson, 40 years old. Now, if you've put the DOB here, do you need to tell us her age? You know, we are numerate. We can count. Who is presenting with depressive? Right. Now, purpose. What do you want me to do? Your assessment will be highly appreciated. Well, appreciated by whom? By whom will it be appreciated? You don't need this kind of sentence. And why does everybody use this? Highly. Are they doing you a personal favor? No, they're not. Are they lending you money? No, they're not. So, thank you. So, I am writing to request your assessment of Miss Jackson, blah, blah, blah. Okay? Direct and to the point. Right? So that's your purpose part. Miss Jackson has a depressive, has family history of, let's see, that should be 2 S's, depressive illness by her mother, so he has always a depressive illness of her mother, and her older sister was died. How can we do that? Older sister died 6 weeks ago of what's your grammar? Heart attack. She also has postnatal depression. Short sentence, short unconnected sentence. So okay. So you could have, made that a little better, I think. On the 13th of the 1st, Miss Jackson was complaining with sleep disturbance, lack of energy, depressed mood, and over past months, I know the past months, what the past few months or several months, we need some quantifier there. Her weight was decreasing. What? It was decreasing how? Why is it passive? So she lost weight, or she has been losing weight, or she had lost weight, but was decreasing. That doesn't work. Can't use that tense. On the examination, she was looking thin. How can you look quiet? How does that look? Exactly. Oh, you're looking very quiet today. How does that work? Exactly. She was looking thin and seemed quiet, or was quiet, with no detection of physical abnormality. Also, her weight was 62 kilograms, and counselling. So this verb here, who is counselling whom to do what? So she was counselled. Counselling was arranged with a local circle. So I'm not really sure what these two verbs are doing here. What is supposed to be going on here, because that's not very clear at all. Okay, Miss Jackson, make that capital. Was still very depressed. Well, it's a mood, so you don't have to say that. And right, we need the verb. And was having, had. So as it's an activity, I would use continuous, and was having difficulty to do or doing a normal daily activities. Regard, what you mean regarding what? Regard her attending social worker on this sentence does not make sense at all. What is this? So is this supposed to be, hang on, right, is this a separate sentence? So this is far too long and it doesn't make any sense at all. Regard her attending social work on a weekly basis with increasingly withdrawn according to her family. That is nonsense, nonsensical. That needs some serious work. I'm not really sure what you are trying to say there. Regarding her attending her social work, or regarding what? So I'm not even going to try. No idea what that is talking about. Nonsensical. And the examiner will do exactly the same. They won't even try. On today's review, Miss Jackson she was brought in, if it's passive, by her family. Now, who has the low self-esteem? Was it her family or was it her? Dangling participle. Was brought in by her family, who said she had very low self-esteem. I mean, would you bring this in? Oh, doctor, my daughter's got very low self-esteem. So that doesn't really make a lot of sense either. Refusing to feed. You feed an animal. A person eats. They do not feed. And it was refusing to eat at home for the last few days. However, she was incompatible. Well, are you sure you mean incompatible, or you mean she was non-adherent? Because that's not the same. It's not the same thing at all. My medication for the past 6 days with slight loss of water in the body. So two completely unconnected facts in one sentence. So this is one sentence. This should be two. Far too long and complicated, just like the previous sentence. In light of the above, I am referring Ms. Jackson for further assessment and treatment. Ms. Jackson, you. Any queries? Can you hesitate to contact me? Okay, well, some confusion with some of the sentences here. This one here in particular, I have no idea what that is supposed to be saying, and that one's far too long as well. You need to break the sentences down, make them clear. The examiner reading these will not be pleased. Okay. Mohammed, right. Dave Cochran, writing to refer Mr. Cochran's symptom signs. The collocation is signs and symptoms. Nobody ever says symptoms and signs. It's always signs and symptoms. So just to your further management, for your further management. And admission to the, because it's a particular unit, cardiology. Unit is a 53-year-old married what? Married's an adjective. You mean a married man with 3 children. And why are you telling me this? Is this anything to do with me? Presumably, I'm a heart specialist, so why are you telling me this? It's very interesting. And don't use first names. You only use first names if it's a child, a Mr. Cochran. Mr. Cochran. Okay. Quite? Quite smoker? No idea what that means. Drinks too much. Isn't this subjective? Aren't you not supposed to be subjective? What does that mean exactly? You're not supposed to be judgmental in either writing or speaking. He retired 3 years ago. Okay, well, unless you're going to do something with this, what's the point of telling me? However, and why is there a however? This indicates a contrast. What's the contrast between him retiring and not doing any regular exercise? There is no contrast. They're two completely separate things. So that does not work. Initially, Mr. Cochrane presented with chest-itis, coughing, especially at night, shortness of breath, which is improving, which was improved because it's in the past, or which simply improved, we can say, because it's in the past tense. When his head was raised. Presumably, all this is in the past. Okay. His examination revealed dyspnea had to do with pressure. Both his ankles were edematous, along with feeling his apex of that. So, right, both his ankles, so at least use a comma. Both his ankles are edematous, also, which is not the same thing as along with, also feeling his apex. Who was feeling what? You felt. So that doesn't work either. That needs a bit of reworking. His ECG, chest infections, results were prescribed. Mr. Cochrane's symptoms. Have improved. 2 weeks later. Why are you using present perfect? Shouldn't it be past perfect? Because this is it is in the past, yeah. Had improved as he started, so a simple past perfect. Mr. Cochrane's symptoms had improved as he started to decrease smoking and drinking alcohol. We'd probably say reduce. Okay, but you can use that. Today, Dave, you don't use, if it's a kid, it's a Cochrane suffering from chest pain. But if it's a unit, particular unit, an article. For further inquiries and to contact me. Okay. So not too bad. Some information that we might not really need unless you're going to draw some parallels or conclusions with it. Some grammatically incomplete sentences, and watch these past tense verbs. They need a bit of attention there. Right, I've got another 2, and then I'll come back for questions. I say, as you can probably tell from my voice, I'm not sounding good. As you are doctors, perhaps I should ask you for some advice for the cold. Maybe. Anyway, writing to refer this patient who I suspect of having a kidney stone. He requires further assessment, a possible intervention, including a CT scan. Okay. Mr. Cribbs first presented 25th. 3-hour duration of excruciating. Right. When excruciating pain which lasted for 3 hours. The 3-hour duration of excruciating pain is right. The abdomen, which was radiating to the groin, or nausea, urine frequency were normal. No history of trauma or fever. Abdominal examination. Well, because you can count it, or his abdominal examination with a slight tenderness. Were prescribed sodium suppository dose twice a day. Were prescribed. Is that a single dose? Then it should be was. Shunt it. An IVP. investigation. Investigation, you mean a test. You investigate, or private detective investigates. That's a test, isn't it? I'll review 2 days later, Mr. Cribbs. Make it, don't forget your thing to make it a possessive, a genitive. Mr. Cribbs' condition had made no improvement. Well, had made or had shown no improvement. IVP, the IVP or his IVP showed ectopic, showed right. So the kidney is countable, an ectopic in a large right kidney, and that's one preposition without any evidence of stones. And the UFR, or his UFR, revealed a few red blood cells in the urine. I ordered it's countable, ultrasound. Come back in 2 weeks' time. On today's consultation, Mr. Cribbs reported that he had experienced mild pain or a mild pain in his lower abdomen for 5 days, which responded to. I would probably say which was responsive, because it's not finished. You know, because if the pain had finished, he wouldn't have come in. So it's presumably he's still in pain. So Mr. Cribbs reported that he had experienced pain for the last 5 days, which was responsive to Panadol. Abdominal ultrasound is supposed to make these grammatically complete sentences. An ultrasound can be counted. Has shown, shows, well, present perfect, because it's happened today. Presumably you gave him the ultrasound today, or is this the ultrasound that you ordered the previous consultation? So you could maybe leave it for present perfect then. An RDE felt a firm mess in the right kidney that is situated below normal. Blood pressure was high, and to extent as he was hired for a new job. Okay. Manage Mrs. Mr. Cribbs' condition as you feel appropriate. Okay, so that's not so bad. Not so bad. Just watch article use. Because some of these things can be counted, are countable. Okay, last one, and I'll come open some questions. This is Daniela Stakovitz. First patient whose features has management of her condition. Please note she's married and has. Why should I note this? And I should note this because, and why should that be in the opening? The opening should be purely purpose. Anything else should go into a history section. Mrs. Stakovitz or Stakovich, depends where you come from in Europe. Presented my surgeon with gastric pain with nausea, which lasted for 1 hour. Yesterday night or last night. The pain felt severe colicky pain, which lasted for 2 hours, accompanied by an episode of vomiting, and this was not, or I would usually use which or that was not relieved. Vomiting, yeah, probably use relative pronoun. That was not relieved by aspirin. Use relative pronoun and make it passive. Location pain was overweight or upper quadrant of abdomen, or the abdomen, or her abdomen was mild attended with no bowel sounds. Negative. Accordingly, LTS and ultrasound were requested. The patient did not experience on review. You mean had not experienced. The patient had not experienced, so had not. Make it perfect. Experience any episode of pain. However, laboratory examination or the or her laboratory examination revealed And I wouldn't use, I mean, lab, exactly what you mean, her lab test results, not laboratory examination. Revealed raised levels of alkaline phosphatase and ultrasound, because it's countable. Showed small contracted gallbladder, and gallbladder is countable too. Take over this stack, that's a further assessment and possible surgical management. Please note that she is now, I saw this before I, so she is assured. Please note that she, what you mean, she is reassured over her concerns regarding cancer suspicion. This isn't really worded very well. I'm trying to guess what you are saying here. Please note that she, I don't really know what you mean here. Please note. So it could be, please ensure that she is reassured over her cancer concerns, or her concerns over the cancer. So she thinks she might have cancer, and you want the reader, to reassure her. I'm not quite sure. Or please note that she is assured. What? So please note that she is concerned that she may have cancer. So I'm not really sure what you're trying to say here. It could be one of several options. That's not very, very clear at all. So relative pronouns, subject, verb, so a bit of grammar there. Okay. Let me just sort out this. Oh. Right. Okay. So that was a quick scan of 5 letters there. I'll post the names in the groups. I don't know if any of you were amongst those, but this recording will be going on to YouTube, and I'll post the link in all the various groups on Telegram and Facebook. Now, anybody, any questions? I've got a bit of time left, maybe about 10 minutes left before Zoom ends. So you can either raise your hand or type your question. Now, I'm not using the camera today. As you can probably hear, I'm not so good, and I'm not really at my best. So I decided not to use the camera. Plus, you don't want to see me blowing my nose every 30 seconds. So come on, questions. Anybody, you can either type or you can raise your hand, and I'll turn your microphone on. If nobody's got any questions, I shall go. I'll post this video. Anybody got any questions? Right, that's a no. So I'll post this. Wakay's letter was quite long. Vikram. Well, length itself, it's only, which was Wakay's letter. Let's have a look. 298 words. Yeah, that is a little bit long. True. They could have maybe cut some of this down, but the word count itself is not necessarily. Right? There's no automatic penalty. Right? There's no automatic penalty. But what the examiner would do, they would say, "Oh, that's quite long," and they would consider if he or she, whoever the author may be, had added any irrelevant information. That's what they would consider, not the actual word count as such. Oh, shit. Oh, dear, sorry. This is why I don't have the camera on. Oh, dear. Oh, sorry. Sorry, I'm a bit shit. Well, it should be concise, but again, they're only gonna deduct marks if there's irrelevant information. And I'm not analysing this in my full way according to the criteria. I'm just having, because that is something else which I'm not going to be doing here. I'm just mainly looking at the very general basic mistakes of grammar and vocabulary. I would have made that letter a little shorter, yes, but I was looking at more the English part than anything else. I know the criteria perfectly well, but that level of analysis, I'm not going to do it here. I do it in my premium letter correction service. I go into a lot of detail there, and I go through the criteria. I'll show you a quick example of. Let me see. What was the last one that I did? I'll just show you so you can see. Where are we? Yeah, right. Now, I'm not doing this level here because I'm not getting paid. And yeah, so in terms of the criteria, so I go through it, and as you can see, there's a lot more detail about the grammar. I make changes. There's quite a lot of stuff here. And then I've got criteria, purpose, content, blah, 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 blah. But for these 3 sessions, there's no way I'm going to that level of detail. So Huawei says should be the exam date, start of a letter. That's when you are writing it, and it will tell you, use this date. Okay, how can we avail your premium service? By sending me money. How do you think? No. I don't know where you found me, if it's on Telegram or Facebook, but you could write to me there, and I'll tell you. I usually do, well, you found this link on some site, either presumably on Telegram or on Facebook, so you can write to me there. I do 1 letter for €12, 4 letters for 40. And that's the level of detail that I showed you, like this. This is the level of detail that I do for that, all the criteria and grading. But for this, it's just a quick look at the general stuff. It's like when I post those photographs on Facebook or in Telegram, it's just because I found that quite a lot of people, and it shows also people are posting in Telegram and on Facebook, and it's obvious that their English is not as good as it should be or could be. There's like many grammatical mistakes. So this is the first thing that you need to be sorting out. So anyway, there's some grammar mistakes there that could do with a bit of attention. I'm not going to go through. I mean, for that, what I would probably do, I would take 1 letter and the case notes, and I would do it and go through it, in such a way. I might do that another time, but that's not really helping you as such, because you need your letters assessing. So me saying, okay, here's a letter, here's the notes, we should have done this, this. That's okay, but it's not pointing out your errors, your mistakes. And that's what's, that's the most important part, I think. So, anybody else got any questions? Because I've only got 5 minutes left before this free Zoom ends. Only 5 minutes. Nobody want me to turn your microphone on so you can ask? Okay, right. I'll call that quits. I'll put the link to this recording in the channels and the group so you can watch it later. I'll be having some more sessions this week. I don't know precisely when. I was intending to have one every week, but then yesterday, I don't know how I came down with this cold. And as you can hear, I'm not very clever. So I don't really know when the next one will be. And of course, it's Christmas here, so I wasn't intending on working at Christmas. However, it's possible that I may well do something on maybe Christmas Day, maybe on the 26th. But anyway, I shall be doing some before the next examination. So you can write to me on Facebook. You can write to me on Telegram. I'll give you my email. So if you need any help, I don't know if have you seen my channel, my YouTube channel. I'll just quickly put the link here. So because lots of videos there for IELTS 2 as well as OET. I'll just put the link to that so you can subscribe and you'll see the videos when they're done. Okay, so I'm going to process this now and stick it onto YouTube, and I'll put the link in all the groups. So sweet. I hope that helps. I'll see you another time. Okay then, bye for now.